I hope you've had a really good weekend. So today I thought I would talk a bit about my book, which is available for pre-order, coming out on Thursday. So a very exciting week for me next week. So I thought I'd do a general Q&A and just talk a bit about the book and why it's different to the hardback, and just, you know, what's in it really. There's lots of menopause books around now. Mostly menopause books seem to be at the bottom shelf under pregnancy in the top floor of bookshops, tucked away, which drives me mad, because in my mind everybody should read this or read some of it, even if they're not menopausal or perimenopausal, or even if they're never going to be perimenopausal or menopausal. They'll still know someone that's suffering in some way. So I wrote this, and it's called The Definitive Guide to the Perimenopause and Menopause. So it's a huge amount of work, and actually I read it recently, so the audio is now my voice for this book. And when I was reading it through, I'm not often proud about what I do, but I'm really proud of this book. It's got lots of information, lots of references in the back as well. So if I've written something that has a little number, then you'll know that it's related to a paper, an academic paper that I've read and referenced in the back. But I've just marked a few areas, and I thought I would go through. Thank you for so many of your questions. A lot of the questions have been about those types of HRT, which I'll talk about as we sort of work through the book. So the book is written so people can either literally sit down and read the whole lot, or they can dip in and out of it. And if some of you have seen the hardback, the introduction is the same. So it actually starts with a very harrowing story, but I've done it because the menopause can be harrowing for some people. And this story is a true story, and really sad what happened to the person that I'm writing about, but hoping it will make people think that menopause is more than just a few hot flushes. And it's a massive problem. As you know, there's 1.2 billion of us worldwide. Most women who are menopausal or perimenopausal struggle to receive the right advice, support and treatment, and that's really got to change. So a lot of information that I give is freely available. There's the Free Balance app, there's our free balance-menopause.com website, and the books are available in libraries as well. So it doesn't mean that everyone has to go and buy it, but just maybe have access to it too. So talking through, I'd start actually defining what hormones are, what they do in our bodies, and I've extended the area about PMS and PMDD because I'm learning about it all the time. It was something that I was never taught about, and certainly as a GP I was taught just to give antidepressants to women who had PMS and PMDD, but just to give them in the 2 weeks or so when they're feeling very low. Didn't really think about hormones, didn't understand hormones. So I'm learning more and more, especially about the role of progesterone and testosterone, as well as estradiol for women with PMS and PMDD. So I've extended that area in the book, and throughout the book there are people's stories as well. So I've got expert voices, but also real people telling their real story, which makes it so much more powerful, I think. There's also results of a questionnaire. So before I did the book, I did a survey of nearly 6,000 women. So it's the largest perimenopause and menopause survey actually in the world, I think. Tell me if there's another one that's bigger. Really interesting results that we're writing up now, but a lot of the statistics are weaved through the book as well. Just interesting looking at the symptoms people are experiencing, the way they've tried to access help, but also the way that they've spoken to other people or not spoken to other people. So I've got an area in the book here about how we can bring up the conversation of perimenopause and menopause to others at home, in the family or in workplace as well. And I've written some results of the survey, who was able to receive help and who actually found it difficult talking to other relatives, and often female relatives. It can be very difficult talking to your children or even to your mother or a female relative about the symptoms that you experience. And actually I've got a story here from Jess, who's my oldest daughter, explaining how awful I was to live with when I was perimenopausal and didn't realise it. And it's interesting looking at it it from her perspective as well. Obviously, she didn't know what was going on. She does now. And if she did know then, she might have been able to guide me to a quicker diagnosis to be able to receive the right treatment for me. So quite a lot here about with your family and how to talk. The other area that I've highlighted is about HRT. So obviously hormone replacement therapy, I've spoken at length about it and done Instagram lives on it, so I'm not going to go into too much detail, but I've written a lot about how to know whether it's the right dose or type for you, and that's really important. Obviously this book was written before the new guidelines that have come out by the British Menopause Society, the Royal College of Obs and Gynae, Royal College of GP, Faculty of Sexual Reproductive Health have come together to produce some guidelines with about bleeding, but actually what's written in here is still right. There is no new there's no new evidence, there's no new studies that have come out since this book was written, just to reassure you. And I talk about how important other guidelines, you know, NICE guidance and also other British Menopause Society guidance are clear about individualisation of dose. We're all different and we often need different doses of hormones at different stages as well. So when people are perimenopausal, they'll often need a different dose to when they're menopausal. So things can change, but so it's explaining about doses, about absorption, different reasons why people might need various doses according to their skin type, their skin thickness, their blood supply to the skin, the temperature of the skin, even ethnicity can change absorption as well, and also about why some people might need higher doses than others. And a higher dose, as I've explained before, doesn't mean that there's a higher level in the body. Some people have been told that there are risks with higher doses, but actually when you look at the reason we give higher doses to some women is because it can improve the absorption. So some people have thicker skin. Some people, for example, my patches do not stick on very well. So 2 not sticking on well patches can be similar to 1 patch that sticks on well in another person. So it's not the dose, it's the amount that goes into the body. So there isn't any evidence that using a higher dose leads to a higher amount in the body. And even if you look at the amount in the body, there is no evidence that shows that women with higher amounts in the body have more health risks. We're all very different. And what we measure in the blood is only a guide as well. It's really important knowing what is going on in the tissues, especially the brain, for those of us that have brain symptoms as well. So hopefully that part will be reassuring for people when they can read and look at about the individualisation of both estrogen and progesterone dose. And sometimes we do change the progesterone dose. Certainly if someone's bleeding, regardless of the amount of estrogen they're on, we'll often change either the type of progesterone or the dose of progesterone to obviously limit bleeding. Some people have asked about why they're still having periods and they've been on HRT for many years. There is a type of way of taking HRT which people have the progesterone for 2 out of 4 weeks. In that time, then people still have periods. What we normally do after a year or so of taking HRT in that way is change it so the progesterone is taken continuously, so every night, so people shouldn't get periods. So if you are still having periods and you are on a type of HRT which you're not taking the progesterone all the time, then it's worth talking to your doctor about changing it. You don't have to wait for a certain age. You know, the best thing about being menopausal often is not having periods. So the sooner you can change HRT, so you're not taking, you're not having periods, the better. I've also had one of our pharmacists, Hayley Berry, who works with us, to write about an expert view, HRT Supply, what to do if I can't get hold of my usual prescription, which is a recurring theme. And in some ways it's good, but in some ways it's bad. The reason it can be good is that it shows that demand is increasing. We know HRT prescribing has increased in the UK and many other countries, and that's because women are understanding how safe and effective HRT health. So but what is frustrating is that drug companies cannot always keep up with demand, and it's not just in UK, obviously where I am today, but in other countries as well. There's often shortages, which is incredibly frustrating. So Hayley has written about what to do if there is a shortage, which is quite useful. I've also written quite a lot about testosterone and how it can be useful for many women. I have written about hypoactive sexual desire disorder, HSDD, which is the indications from guidelines about giving testosterone. But I've already said HSDD is a very specific diagnosis. It affects many women, but actually there are other reasons why people often find taking testosterone can help. So it can often help our mood, energy, concentration, stamina, sleep, reduce muscle and joint pain as well. It's an important hormone, and it tells you about how long it takes can be before it makes a difference, what side effects can be, and a case study as well, of course, of someone who's taken testosterone. And then there's a section about vaginal hormones, which I've added more to as well, because it's not just vaginal estrogen, it's vaginal progesterone, which converts to estrogen, and testosterone, which I find personally can be very useful for a lot of women and increasingly use it first line. Chapter 5 is about mental health and hormones, and in my mind this is a really, really important chapter, more important now than it was when I wrote the book initially, because I realised more and more how much mental health can be affected. And certainly in the survey, the questionnaire that we did, the commonest symptoms affecting people, over 90% of women had brain fog, had low mood. A lot of women, a really significant proportion, had anxiety, poor sleep, memory problems, fatigue. All these symptoms can affect our mental health, and so increasingly I'm realising more and more that perimenopause and menopause really is a neurological condition, not an ovary condition. It shouldn't be a gynecological issue. It should be thought of as a multi-system disorder, but especially affecting our brains. And since I've written the book, I've done a lot more training for psychiatrists, and psychiatrists are brilliant, actually, really want to understand more, but actually they feel as frustrated as me that they haven't been given specialist information about hormones and the role of our hormones in our brains as part of their training. And hopefully that is going to change, because mental health and hormones are so closely linked. So I've written about this in some detail because it's so important, and thinking there's even one bit here saying I've been offered antidepressants but I don't think I'm depressed. What now? Really important when so many women I speak to have been offered or given antidepressants and they say that they're not depressed, or when they take antidepressants makes them feel a bit numb but doesn't really improve their mental health. So how we can be thinking about what to do. And also throughout the book I've got these timeout sections as well. So for example, in this one, on the mental health chapter, I've got timeouts. Number 1, unwind in 5 steps. So things that we can do to just try, not always easy, to unwind, like for example positive thoughts, the power of reflection, be active. So looking really holistically throughout the book, I've tried to give tips for as many people as possible that are achievable and possible. So it's not just about taking HRT or not taking HRT, it's what else we can do to really improve our mental and physical health as much as possible. And how we can help ourselves as well. So really important, this area. And then I've got a case study of someone called Anna who had really bad actually, OCD, obsessive compulsive disorder, and she's very open about her disorder and how she was given so many different psychiatric medication before she realised, and the doctors realised, her symptoms were related to her hormones. And then another lady, Margaret, who talks about ADHD and menopause, which increasingly is more obvious that it can be related to hormones as well. And then I've got an area here about sleep as well, with an expert, Dr David Garley, talking about how to try and improve our sleep, which is also really important. Next chapter about skin and hair. I did an Instagram live last week, which is on my YouTube now as well as on the grid, talking about skin and hair and menopause, and the lovely Dr Sad Rajpal has weaved his expert view throughout, but that's a really important section for many people. And then I've had a whole chapter on menopause in younger people, including surgical menopause. And increasingly I'm hearing from women who are in their 20s and 30s who are really neglected. It can take many years and many consultations often before people are thinking about menopause in younger women. And often people are prioritising more for women in their 40s and 50s and talking about menopause as a midlife condition. And actually I feel very strongly that we should be looking more at helping younger women, especially women who haven't been listened to, and a lot of women who've had a hysterectomy for various benign reasons. So for example, endometriosis, they've been told because they've got endometriosis they can't have hormones because estrogen can trigger their endometriosis, so they have everything taken out, their womb and their ovaries, and then obviously their hormone levels are low, and the gynecologists I know people whose gynecologists have said to them, well, you won't have hormones, you won't have problems with your endometriosis, but then they get all these other symptoms and future health risks as well, especially if they're young. And so it's finding the right dose and type of hormones if that's appropriate for them. So often, actually, after a surgical menopause with endometriosis, increasingly I'm giving progesterone and testosterone and leaving the estrogen until all the inflammation is settled with those very anti-inflammatory hormones. But it's all very individualised. So I've got a section there for people. And then this is also a really important area. Chapter 8 is menopause and cancer. And so I'm talking about how cancer treatments can induce menopause, what symptoms can occur, and treatment options, including benefits and risks. And then I do a specific spotlight on breast cancer, and Dr. Sarah Glynn, who's an academic who works with us and also a menopause specialist who works elsewhere, not in my clinic, has really expanded the section because we've been looking more and more about the evidence and regarding women who've had breast cancer and hormonal choices after that. So we've extended the section there, which is really useful, I'm hoping, for a lot of people. So talking about if you are having treatments such as aromatase inhibitor and tamoxifen, about vaginal hormones, and an expert view as well from another doctor, Dr. Alison Macbeth, and then a case study as well about someone who had breast cancer who decided to use vaginal hormones. And there's a little section about women who've had a family history of breast cancer as well. So I'm hoping that will be really useful. Then this is another chapter that I put in right at the end, actually, just before my hardback became set by the editor. I decided to write another chapter one weekend, but I think it's the most important chapter, actually, and I have extended on it more. And it's actually chapter 9 here. It says, Unseen and Unheard, Why the Menopause Conversation Must Be More Inclusive. And for many of you who know me, you might realise that I spend a lot of my time trying to think how to reach women who I'm not reaching at the moment. So who I'm not reaching through the Free Balance app. I'm not reaching through my podcasts. I'm certainly not reaching through my clinic. And so I've been really writing about this as well, and how we can think about people who need more tailored information. So certainly women from different ethnic groups, trying to break down cultural barriers. Also talking about women from, I've got a bit here, a section here, perimenopause and menopause in LGBTQ communities, really neglected group of people who can often struggle to be listened to. And then women who are in marginalised communities, so menopause and HIV. And this is an area that's really important to me, is menopause in prisons. As some people might know, I worked in a prison in 2000, in Style Prison, and recently I've been going back to some prisons and listening to women's stories, how they're struggling with their menopause, which is hard enough for most people, but when you're on a plastic mattress in a bunk bed with another prisoner who isn't menopausal, and you want the window open and they don't want it open, or you're struggling with your mental health and you're menopausal as well, but you're unable to access HRT in the prison, it can be very harrowing and a very difficult time. So I talk a bit about what I'm doing currently in that area. Menopause and domestic abuse, again, really important. And also about menopause and addiction and eating disorders, which is another area that's often really neglected, and we've got an anonymous case study talking about menopause in alcohol recovery. Really, really important, but often not considered enough by other menopause specialists and societies, but an area that I want to really amplify with my work going forwards. There's quite a lot about exercise, which is really good, and very fortunate to have body coach Jo Wicks, who I'm sure you've all heard of, writing about what more we can do, and there's always more we can do regarding exercise. There's quite a lot about nutrition as well. Emma Ellis-Flint's got some great recipes that are very easy, as well as just thinking more about what we can do, and I've obviously spoken a lot about nutrition before. And then workplace is something that's so important, and so I've extended that area. We've got someone called Louise Tyson, who's a managing director of Newson Health Group, talking about empowering women to retain and thrive in the workplace, and that's so important. We've heard so much more about workplaces being more responsible for menopause, but actually also we still know that around 10% of menopausal women are leaving their jobs as a consequence of their menopause, and it's often symptoms such as brain fog, anxiety, low mood, poor memory. So it's not worth just thinking about uniforms and fans. And actually we don't all want flexible working and reduced hours. We want to do the best job we can, and we often want to be promoted at work. We don't want to be working at home. We don't want to be taking a different job because we're menopausal. So thinking about the huge statistics globally about women not being able to fulfill their potential because they're not able to access treatment that's relevant to them, which is absolutely shocking. So we've got some statistics there which are really, really important. And then at the end, I'm really, really pleased actually. There's another expert view, but this time it's from someone called Joanne Harris, who is an author herself. She wrote a book called Chocolat, and also more recently Broken Light. And she actually writes about ending the invisibility of menopausal women. And she talks about how so much in society it's almost convenient for women to be menopausal, to not be heard, not be listened to. And she talks about why we need to change, and how certainly in menopause we've vanished from society far too quickly and far too frequently. And so she's very poignant in her words actually, and I'm very delighted that she contributed to the book. And then it ends with a final message to all of you who are reading or listening to it. So I won't share that with you because you can look when you get the book. There is going to be a free copy of each of this book in every prison as well. My publishers, Yellow Kite, are really committed to helping as much as they can with that. And I've got some events next week which I'm very excited about. I'm going to London on Tuesday to do an event with lovely Liz Earle, and then I'm going to be in Abingdon on Wednesday, and then on Thursday I'm going to be in Henley Book Festival with Kate Muir, which will be a lot of fun. But this is just it's just part of empowerment, this book. I'm also now writing another book, so if you've got thoughts or more other ideas what you'd like me to add in my new book, then please let me know, because there is so much that we need to talk about, and so much we need to understand to improve future generations. I'm really committed to trying to give as much information and knowledge as possible so that women can have a really positive time of their perimenopause and menopause. In my mind, nobody should be suffering. There's enough suffering going on. There's enough things that go on out of our control. So we want to be in control of our hormones, of our health, of our happiness, everything else as well. And so hopefully this is one part that's going to help. But it's not everything. You can't just read a book and expect it to do everything for you. We've got to take control. We've got to take ownership of what we're doing so that we can help others. Really important for future generations as well. So important that we can choose whatever we want, and combination of treatments, but it's also really crucial that we're looking at our future health all the time as well. As I've said many times before, When we're menopausal, we have an increased incidence of heart disease, osteoporosis, diabetes, clinical depression, cancers, and dementia as well. So anything we can do to reduce that risk of diseases, to stay well, is really, really important. And I also, Lisa Mosconi, the fabulous neuroscientist, has extended her section on here about dementia, including some really great research that she's recently done looking at dementia risk reduction in women who take HRT. So it's crucially important. I was actually in hospital a couple of days ago with my daughter who'd had an accident, and there were no beds in hospital, as you can imagine, so we had 36 hours in a corridor. But actually, whenever I walked to the toilet, I walked past beds and most of them were full of women, elderly women who, I don't know, they certainly were menopausal because of their age. But I wondered how many of those were taking hormones. I wonder how many of those had had osteoporosis or dementia or had a heart attack. And it really made me think more and more about when I was working in hospital, about how many women I saw admitted to hospital and how many women were definitely not taking HRT. There were very few who I saw in hospital who were taking HRT and had really looked after themselves. And, you know, when people are ill, it's so easy to think, I wish I'd looked after myself before. My mother's not very well at the moment, and I think I wish she had exercised more. I wish she had done things slightly different. It's too late now. But actually, it's a real incentive when you just look around and look at people who are maybe not as healthy as you. Some of it is genetic, of course. Some of it can be luck, but a lot of it is quite hard work. You know, it takes a lot more work to cook food properly than just to go and buy something. I was in a supermarket today just getting a prescription for my mother, and I had 20 minutes wait, and I was looking around the supermarket thinking, how much here would I actually eat? And it was vanishingly little. The amount of people with trolleys, with fast food, with fizzy drinks, with crisps in their trolleys, it's just mortifying. So we have to take responsibility of what we're doing. So there's a lot we need to do ourselves, but actually a lot of us as menopausal or perimenopausal women also need medical help as well. And we shouldn't be ashamed of asking for help. And certainly if we're not getting the help that we feel that we deserve in our first consultation, go and see someone else. Many of us have had to see more than one doctor or specialist before we feel listened to and feel that we have individualised help. There's quite a lot of narrative, there's quite a lot of own agendas setting in menopause at the minute, and there's a lot of people commenting and stating lots of things that aren't evidence-based. So you have to do your homework, you have to know what's right, and if you're being offered something that you feel isn't right, then you can challenge it, you can ask to see someone else. And some of the guidelines that come out, they are guidelines. They are a tool to help clinicians, but we don't have to be 100%. Not everybody is textbook. We're all individual, and so medicine is an art as well. So seeing someone who's got good clinical knowledge and experience and understands you as a person is really, really important as well. So I'm going a bit off topic then, but I just want you to know that there are lots of people out there that can help you, but sometimes it can be difficult finding the right person. So for those of you that do buy the book, I hope you really enjoy it. If you go to drlouisenewson.co.uk, that's the easiest place, and you can just pre-order there and it will list different places. For those of you that are abroad, I've heard that Waterstones do send abroad, and also Blackwell's Bookshop. The links are in the drlouisenewson.co.uk website. They will ship as well abroad as well, which is good. So, and also the audio, doesn't matter where you are, you can listen to it. So let me know when you've received it after Thursday. Let me know any feedback, good and bad, and future ideas for the book I'm working on now. And also for some of you who might be coming to see me in the tour is very exciting. I'm already planning content that people haven't heard. It's going to be quite shocking, some of it. There's lots of going to be some really interesting facts, and I hope that you will enjoy it and be just have more of an open mind when I'm talking about some of the things that I've been researching for the tour. So it's going to be different to things that I've done with my podcast and my book and everything else as well. It's just going to amplify not just my voice, but our voices as menopausal and perimenopausal women, because we've got a lot to do to change the future for next generations. So enjoy the rest of your evening, and thank you for tuning in. I'll put this on my podcast, on my Instagram, and then it will go on to YouTube. And I look forward to speaking to you next week. If any of you want to see the topics that I've got planned, if you go to drlouisenewson.co.uk under the events section, it's been listed for you which topics I'm going to be doing on Instagram Lives on a Sunday. And thanks for all your wonderful support and feedback, and let's just keep this journey together. I'm working with a wonderful team. There's so much we need to do, but we're really committed to helping as many people as possible. So have a great evening, and thank you.